My name is Zaid Sadiq. I'm a consultant oral maxillofacial surgeon. I have been a consultant since 2014, having worked at various centres within the UK. I currently work at Queen Victoria Hospital as a consultant oral maxillofacial surgeon. My specialist sub-interest is in head and neck cancer, particularly focusing on mouth cancer and reconstruction. I also cover within my practice activities relating to facial trauma as a result of personal injury. Alongside with my NHS practice, I'm also involved in the Medicolegal reports and analysis of patients who have had delayed diagnosis or mismanagement of oral cancer reconstruction. I'm able to provide reports relating to breach of duty and causation. Another part of my medical legal practice covers patients who suffered facial injuries as a result of either road traffic collision or alleged assault. Again, there are issues in terms of causation and breach of duty of care. The common scenario that I am involved with is where patients suffer facial fractures or cuts to their face, medically known as lacerations. These patients usually present to accident and emergency and not always present to a specialist within the accident and emergency department. So on occasions, these cuts on the face or breaks in the jaw are not managed appropriately, and there is a delay in acute management. Eventually, these patients do see the appropriate specialties and may require surgical intervention. This usually involves an operation to, if you like, fix the breaks or deal with scarring. As a result, the treatment is delayed with poor outcome in terms of their bite or facial appearance. This can have an effect on patients' quality of life in terms of return to work, socialization, and mental health. Further cohort of patients that I've provided multiple reports for, again in terms of condition and prognosis, are patients who've been seen by a dentist and have had surgery on their teeth, and that's mostly involving wisdom teeth surgery or the placement of dental implants. There are risks associated with this procedure. The most relevant is either infection, retained tooth fragments in the jaw, and most importantly, numbness of the lip and or the tongue. This can happen due to complex surgery or negligent surgery. Patients tend to present several weeks after having seen the dentist, and they classically present with a numb lip or tongue or a misplaced implant into the upper jaw, into the sinus, leading to sinus problems. Again, these patients are seen in the clinic and are assessed with scans as well as clinical examination, and treatment for their complications may be extensive with a high surgical burden.